Equetro, also known as carbamazepine, is a medication used to prevent and control seizures. It is also used to relieve certain types of nerve pain, such as trigeminal neuralgia. This medication works by reducing the spread of seizure activity in the brain and restoring the normal balance of nerve activity. In addition, some forms of this medication are also used to treat bipolar disorder, helping to decrease extreme changes in mood and help you feel less agitated. The daily dosage and optimal timing for taking Equetro should be determined by a healthcare professional based on individual needs and medical history. Before you start taking Equetro, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are taking the extended-release tablets, take this medication by mouth with food as directed by your doctor, usually 2 times a day. Do not crush or chew extended-release tablets. Also, do not split the tablets unless they have a score line and your doctor or pharmacist tells you to do so. Swallow the whole or split tablet without crushing or chewing. If you are taking the extended-release capsules, take this medication by mouth with or without food as directed by your doctor, usually 2 times a day. Swallow the capsules whole. If you have trouble swallowing the capsules, you may open them and sprinkle the contents onto a teaspoonful of applesauce or other soft food. Swallow all of the drug/food mixture right away. Do not chew the mixture or prepare a supply in advance. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Tell your doctor if your condition does not get better or if it gets worse. Some common side effects of Equetro include nausea, vomiting, dizziness, drowsiness, constipation, dry mouth, and unsteadiness. If any of these effects persist or worsen, please inform your doctor or pharmacist. It's normal to see an empty tablet shell in your stool, as your body has already absorbed the medication. Remember that your doctor has prescribed this medication because the benefits outweigh the potential side effects for you. Many people taking Equetro do not experience serious side effects. However, it's important to contact your doctor immediately if you experience severe or persistent headaches, signs of liver problems, signs of kidney problems, mouth sores, fainting, irregular heartbeat, vision changes, joint pain, swelling, numbness/tingling, or signs of low sodium levels in the blood. A small number of people taking Equetro may experience depression, suicidal thoughts, or other mental/mood problems. Be sure to seek help if you notice any unusual changes in your mood, thoughts, or behavior. While rare, if you experience symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not mentioned here. Equetro, also known as carbamazepine, is a medication that is used to treat certain types of seizures and mood disorders. It works by restoring the balance of certain natural substances in the brain. Before starting this medication, your doctor may order a blood test to measure your risk of developing serious skin reactions. This is especially important for people of Asian or South Asian descent, as they may be at greater risk. If the blood test shows that you are at greater risk, your doctor should discuss the potential risks and benefits of Equetro with you. It is important to be aware that Equetro may rarely cause very serious blood disorders such as aplastic anemia or agranulocytosis. Your doctor will monitor your blood counts to minimize the chance of these side effects. If you experience any symptoms such as skin rash, blisters, itching, swelling, signs of infection, unusual weakness, shortness of breath, or easy bleeding/bruising, it is important to seek medical help right away. The daily dosage of Equetro will be determined by your doctor based on your medical condition and response to treatment. It is important to take this medication regularly to get the most benefit from it. The best time to take Equetro is usually at the same time each day. Remember to keep all medical and lab appointments while taking Equetro, and always ask your doctor or pharmacist for more details if you have any concerns. Before taking Equetro, make sure to inform your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes any conditions such as bone marrow depression, blood disorders, glaucoma, heart disease, kidney disease, liver disease, mental/mood disorders, and mineral imbalances. Equetro can cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or operating machinery until you know how the medication affects you. Limit your exposure to the sun and use sunscreen when outdoors, as Equetro can make you more sensitive to sunlight. If you are an older adult, you may be more sensitive to the side effects of Equetro, such as confusion, unsteadiness, or irregular heartbeat. It's important to be cautious to avoid falling and to discuss any concerns with your doctor. For pregnant women, it's important to weigh the benefits and risks of using Equetro during pregnancy, as it may harm an unborn baby. If you are planning or become pregnant, make sure to discuss this with your doctor. Equetro can also pass into breast milk, so consult with your doctor before breastfeeding. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. You should not start, stop, or change the dosage of any medicines without your doctor's approval. Equetro may interact with certain medications, such as certain azole antifungals or orlistat. It's also important to avoid taking MAO inhibitors while using Equetro, as this can cause a serious and possibly fatal drug interaction. Some medications can affect the removal of Equetro from your body, which may affect how it works. It's important to discuss with your doctor the best time to take this medication and if you should use reliable backup birth control methods while taking it. Equetro can also interfere with certain lab tests, so it's important to inform lab personnel and your doctors that you are using this medication. And be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. If someone has taken too much Equetro and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include slowed breathing, loss of consciousness, muscle twitching, uncontrolled movements, and a very fast heartbeat. It's important to remember not to share Equetro with others. Before starting this medication and while taking it, your doctor may require you to undergo lab and/or medical tests, such as complete blood count, blood mineral levels, kidney/liver function, eye exams, and carbamazepine blood levels. It's important to keep all medical and lab appointments. Make sure to consult your doctor for more details on these tests and appointments. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the regular time. Do not take 2 doses at the same time to make up for the missed one. Keep Equetro at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. Do not flush Equetro down the toilet or pour it into a drain unless instructed to do so. Properly dispose of this medication when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.